So let's take a look at the quadriceps group. So quadriceps meaning 4 heads, and that's exactly what we've got here. So we've got Vastus Medialis. It's vast, it's big, it's on the medial aspect of the leg. And we've also got Vastus Lateralis, which is, of course, big and on the outside of the leg, the lateral aspect. And actually sits just underneath the IT band, just there. So it wraps all the way around. And then the only muscle that I'm going to include with those two is going to be Vastus Intermedius, which is just underneath there. And the one that I've taken off there is Rectus Femoris, but we'll talk about that in a moment. So that's your 4 quadriceps. We've got those 3 there. Why have I singled out those 3 and removed Rectus Femoris? Well, those 3 only cross the knee. Rectus Femoris actually crosses the hip with its origin slightly higher up. So we'll cover that in a moment. We've got Vastus Intermedius. So the origin of that is going to be the anterior and the lateral shaft of the femur. So let's keep these guys connected. Remove the rest and see what we're left with. So that inserts onto the anterior and lateral shaft of the femur. Sits right next to Vastus Lateralis. So that one is slightly bigger. It's got more and stronger origins. So this one comes from the greater trochanter, just up here, the gluteal tuberosity of the femur, which is just somewhere around here, but also the lateral lip of the linea aspera. So the linea aspera is this little line just in there. It's this kind of ridge along the femur. When you look at a femur and you see it at the back, you can see it's got this almost seam-like structure within the middle. So that's where the lateral, or Vastus Lateralis, comes from. Vastus Medialis, call this the teardrop muscle because it resembles a teardrop, but it actually comes up a lot higher than you might think. So this one comes from the medial lip of the linea aspera. So just that central kind of spine of the back of the femur. And they all converge into the quadriceps tendon just down here. So the quadriceps tendon then inserts into the patella, and that continues down into the patella tendon, or patella ligament if you'd rather call it that. It technically does attach bone, patella, to bone, tibial tuberosity. But this is the common insertion of all 4 quadriceps. It's the tibial tuberosity via the patella and patella tendon. So just there, adding the connective tissue on. So now we've got Rectus Femoris back on the scene. So let's see what he's up to, or she. Rectus Femoris then. It's still a quadricep, but this one crosses the hip as well. And it actually comes from its origin, which is the AIIS. Not to be confused with the ASIS, which is the origin of sartorius. What does that stand for? Anterior inferior iliac spine. So remove it all again. And there we go. Oh, we've still got Vastus Intermedius connected. Get rid of him. Let's take a closer look at that anterior inferior iliac spine. So at the front, underneath iliac spine, spine of the ilium. Sartorius is just going to be just up here on the ASIS, which is superior. And that again, oh, I've selected everything now, is going to join with the rest of those muscles down into that patella tendon and tibial tuberosity. So they're on the front of the leg and they're all going to extend the knee or straighten the knee out. Rectus femoris, because it crosses the hip, is going to act on the front of the hip, which is hip flexion. So just not really talking about common injuries here, but there is one thing we'll mention when we're talking about the tibial tuberosity, which is Osgood-Schlatter's disease, which many people will have had. You may have seen it in clinic. This is that tibial tuberosity there. It's usually 13, 14-year-old boys predominantly, and their bones grow quicker than the muscles can manage. So that quadriceps or patella tendon actually pulls away from the tibial tuberosity, and the body lays down extra bone tissue. It creates an extra little bony lump there. So if you see that on people, they may well have had that in their teens.